other name of plumbism is your chronic lead poisoning, or it is also called as satanism. So we have to write a short note on this, and before starting with exact answer, we need to give some introduction. So in introduction, what you people are going to write exactly how exposure of lead occur in people. So number one, it is due to factories or say food contaminated with lead in your tin cans and water stored in lead vessels, vermilion, which is sindoor used by ladies, then oil helps lead absorption. So these are some points. We're going to read it fast. Number one point, it occurs in people working in factories and industries using lead due to inhalation of dust. Then in paint industries, plumbing industries, glass blowers, electric fire industries, batteries, toys, hair dye, and gasoline industries. Number two, food contaminated with lead. So obviously if you're going to store your food in lead cans and tin cans, then it is going to get contaminated. Number three, water stored in lead vessels. Number four, vermilion or sindoor used by ladies, and oil helps lead absorption. Number five, lead tetroxide, which is sindoor used on the Hanuman idol, also causes lead poisoning. Now, what are the manifestations? Number one, hypochromic anemia with punctate basophilia, that is, red cells show dark blue spots. These are due to metabolic products of porphyrin. So, you're going to observe hypochromic anemia in the persons with lead exposure, and not just hypochromic anemia but punctate basophilia. What is punctate basophilia? The RBCs show dark blue spots, and that is nothing but your punctate basophilia. These are due to metabolic products of porphyrin. Now, what are the other effects on RBCs? Number one, defective HB formation, increased fragility of RBC, and reduced lifespan of the RBC. What are the other features which are seen on peripheral blood smear? Number one, reticulocytosis, decreased platelets, increased monocytes, anisocytosis, poikilocytosis. So lead value in blood is more than 0.8 milligram. Normal is 0.03 milligram percent, but if the value ranges to 0.8 milligram percent, then that is very huge value, which is going to lead to reticulocytosis, decreased platelets, your increased monocytes, anisocytosis, and poikilocytosis. So these are some features which are seen on PBS. Now, what is the second point? Colic and constipation. It is also called as dry belly. This is MCQ. It affects intestines, uterus, ureters, and blood vessels. So you are going to observe colic and constipation also. Colic pain is also there, constipation is also there. The colic is intermittent, spasmodic, and relieved by pressure and is associated with constipation. Number three, cardiorenal manifestations, heart and kidneys. So in cardiac manifestations, you are going to have increased BP, hypertension, then arteriosclerotic changes. In renal, you are going to observe presence of albumin, lead, and coporphyrin 3 in urine. So in renal, we are going to observe albumin in urine, lead in urine, and coporphyrin 3. Also, there is nephritis. Number fourth manifestation is delirium. Number fifth, paralysis, that is called as lead palsy, again MCQ. It affects the extensors of fingers, wrist, and foot, leading to wrist drop and claw-shaped fingers and foot drop. So in which poisoning you are going to observe wrist drop and claw-shaped fingers? In lead poisoning. Then encephalopathy, usually seen in children, headache, loss of the concentration, memory, insomnia, optic neuritis, peripheral neuritis, convulsions, hallucinations, insanity, and coma. What about eye changes? Retinal stippling and optic atrophy. See, retinal stippling is also MCQ. So in eye changes, you are going to observe the retinal stippling is there, then optic atrophy is there. What about facial pallor? Due to vasospasm, especially around the mouth. So around the mouth, you are going to observe facial pallor. So these are the 8 manifestations which we learned in your chronic lead poisoning. Now in total we are going to learn 12. So moving to 9th manifestation, lead line on gums, again MCQ, a blue line which is called as Burtonian line. Very important. Burtonian line, remember the name, always and always associated with lead poisoning. It is seen at the junction of gums and teeth, especially on upper jaw, and is more prominent when teeth are dirty because H2S liberated from food particles combines with lead to form lead sulfide, producing blue line. So you understood the mechanism. H2S is released from the food particles which we eat, and that H2S reacts with the lead and results in the formation of lead sulfide. So lead sulfide has color of blue. That is why Burtonian line is a blue line. It disappears if teeth are kept clean. Sometimes lines are black or grey also. So Burtonian line is a feature of chronic lead poisoning. Blue line is also seen in mercury, copper, silver, iron, bismuth, and thallium poisoning. So what are the other poisonings? In thallium poisoning also you are going to encounter Burtonian line. So blue line is also seen in mercury, copper, silver, iron, bismuth, and your thallium. What about reproductive system genital manifestations? It may produce sterility, degenerate offsprings, and may cause abortion. It may cause death of the fetus, menstrual disturbances, amenorrhea, dysmenorrhea, and menorrhagia. General manifestations: weakness, anorexia, foul breath, dyslipsia, um, then your irritability, pain in joints, and hair may be alopecia. So alopecia may be there. So what are the manifestations? There are in total 12 manifestations. Number 1, anemia. A for anemia, which is hypochromic anemia. B for punctate basophilia. Then we are going to have, then you'll be writing some points about RBCs. Ki there is anisocytosis, poikilocytosis, then decrease in the HB concentration. So regarding RBC you are going to write. Now what about C? Colic and constipation and cardiorenal manifestation. D is delirium, and in delirium again next valid D is wrist drop and foot drop. Then E, encephalopathy, and again E, eye changes. In that, retinal stippling and optic atrophy. F, facial pallor. Fine. Then G stands for your gums, line on gums. So what is that line? It is Burtonian line. Then what about your second valid G? It is genital manifestation. So sterility, degenerate offsprings and abortions. And what is there next? Again we have G, which is general manifestations, and H, alopecia. So A, B, C, D, E, F, G, H is the mnemonic for the manifestations of your chronic lead poisoning. Read it carefully, then you will be able to write it. Then what are the medico-legal aspects? Use of lead for suicide and homicide is very rare. Sometimes it is used as cattle poison and to procure abortion. Poisoning is mainly accidental and is usually chronic. Accidentally there is lead treatment about the snake bite victim. So in management, very first thing about non-poisonous snake bite, you have to allay the anxiety and fear. That is, you have to decrease the anxiety and fear of the patient, and you have to reassure the patients that all snakes are not poisonous. So you have to give assurance to the patient that everything is going to be fine, and it is not necessary that every snake has to be poisonous. Then what about poisonous snake bite? What is going to be the management of it? So first aid and field management. Number 1 is reassurance. Limit the systemic spread of venom by immobilizing the affected part. And for viperate bites, the bitten limb should be splintered if possible and kept at approximately heart level. So in viper bites, the bitten limb should be splintered. Splintered means it should be attached with a support, and it should be checked ki that affected limb should not move. Splinting is nothing but providing support so that the limb does not move. I hope you people understood. Maybe attaching a wooden platform to the leg, or say maybe plastic attachment or anything which helps in immobilization of that limb. So if possible, and kept at approximately heart level. So in this diagram, see, in A image you have to first wash the wound properly with water. Then B image you have to attach the crepe bandage, not too tightly, just in such a way that it is not going to compress the arterial supply. Then third diagram shows there should not be cutting, there should not be squeezing of the wound. And fourth diagram shows you have to call the ambulance immediately. So for elapid or sea snake bites, the Australian pressure immobilization technique is beneficial. In this method, the entire bitten limb is wrapped with an elastic or crepe bandage and then splinted. Splinted means then it is given support. Tourniquet, a proximal lymphatic occlusion constriction band, or tourniquet may limit the tourniquet, a proximal lymphatic occlusion constriction band or tourniquet may limit the spread of venom if applied within 30 minutes. The tourniquet should be applied such that it does not prevent the arterial flow of blood, and the distal pulsation should be appreciated. So the same thing I told you earlier, you have to avoid the compression of arteries. Okay. Then what about the hospital management? Monitor vital signs, cardiac rhythm, oxygen saturation and urine output. The level of the local edema, swelling, erythema in the beaten limb should be marked, and the circumference should be measured every 15 minutes until swelling has stabilized. IV access with fluid resuscitation if needed. Vasopressors, that is dopamine, should be administered. So what they are trying to say, number 1, you have to monitor the vital signs. Number 2, you have to see the level of local edema or swelling in the beaten limb, and it should be measured every 15 minutes. Then IV access with fluid resuscitation. So if needed, vasopressors like dopamine should be given. Then blood and urine should be collected for lab evaluation. Care of bite site, apply dry sterile dressings. Splint may be applied. Then tetanus immunization should be updated as appropriate. If the swelling in the affected limb continues and impeding tissue perforation causing muscle compartment syndrome, intracompartmental pressure should be checked. If pressure is elevated, prompt surgical consultation should be obtained while antivenom continues. So you have to administer the antivenoms and you have to check for the internal pressure as well. If it keeps on exceeding, if it keeps on increasing, then surgical intervention should be there. So antivenom therapy, antivenom should be administered only when indicated. Table 38.5 displays the indication for administration of antivenom. So in what are the terms in which we are going to prescribe antivenom? Deranged coagulation profile. If the patient has deranged coagulation profile, then if there is spontaneous bleeding, rapidly progressive and severe local swelling, persistent hypotension, neurotoxic or myotoxic features, depressed consciousness and lab abnormalities. If in any of these indications you are going to prescribe the antivenom therapy. Now what are the lab tests in snakebite cases? We do CBC in case of blood, blood group and cross matching, liver function test, kidney function test and coagulation studies. In case of urine, we check for blood and for myoglobin, and we also perform ECG to check arterial blood gas analysis and chest X-ray. So these are the lab tests which we perform. And in India, polyvalent antivenom is available that is effective against the common cobra, common krait, Russell's viper and saw-scaled viper. So we have what? We have polyvalent antivenom. Usually the antivenoms are of equine origin and carry risk of anaphylaxis or delayed hypersensitivity type of reactions. Prior to administration of antivenom infusion, the patient should receive appropriate loading doses of IV antihistamines. The antivenom should be administered as IV infusion. It should be dissolved in 500 ml of normal saline or Ringer's lactate or 5% dextrose for adults and 20 ml per kg for children. The adverse reactions of antivenom are given in table below. So severe hemorrhage or bleeding may require blood or fresh flows in plasma. So what are the adverse reactions you are going to observe in antivenom therapy? It is either your anaphylaxis or delayed type of hypersensitivity reaction. In children, remember, you are going to give 20 ml per kg in solution. Then if there are features of neurotoxicity, neostigmine may be required. Every injection of neostigmine should be preceded with atropine. So before giving neostigmine, you should give atropine. Then oxygen, ventilatory support and management of renal failure on usual line. So these are the points under your antivenom therapy. Now what are the autopsy findings? Evidence of fang marks, fang in the sense death of the snake. Evidence of fang marks, local swelling, discoloration, blister formation and bleeding. Then bleeding diastasis, froth at mouth and nostrils, pulmonary edema, congested organs. What is the medical legal importance? Most of the deaths are accidental in nature. Due to snakebite, permanent functional loss may occur in the beaten limb. Though the exact incidence is not known, but such loss may be due to the injury to muscle, nerve or vessels or due to scar contracture. So in medical legally, this type of deaths are always accidental, and most of the deaths are accidental, and snakebite may lead to the permanent functional loss of the affected limb. Then we are good to go for our next question, but remember, in snakebite poisoning you have to write about the lab test which we do and management. In management, remember this diagram, you will be able to write. Then hospital management is very important. You have to check for vital signs. Then you are going to examine the local edema and swelling. Then IV access with fluid resuscitation. Then care of bite site, immunization should be given, and you have to give antivenom therapy. In antivenom therapy, what in India we have polyvalent antivenom. Okay. So two things about this: adverse reactions are anaphylaxis and delayed type of hypersensitivity reaction. So these were the points regarding treatment of snake bite. Now we are moving towards the most important question. Right, this is probably a LAQ. Chronic lead poisoning, what are the sources, what are the clinical features, and what is the management? So lead is also called as sisha. Okay. So what are the properties? Lead is heavy, soft, steel grey metal which gives off toxic fumes when it is melted. Lead and its components are toxic. The toxic components are, what are the components? So number 1, lead acetate, lead carbonate, lead nitrate, sulfate, chromate, chlorate, iodide, sulfide, monoxide, tetroxide and tetraethyl. Remember only 2 names: acetate, carbonate, nitrate for example purposes. What are the sources of lead poisoning? Automobile exhaust, then your battery making, glass manufacture, sisha, Then plastic manufacture, house paints, steel welding and cutting. So automobile exhaust, batteries, glasses, plastics, houses and steel welding are some of the sources. What about the uses used in paint, glazing of pottery and enamel work or enamel wear, anti-knock for batteries, anti-knock for petrol, then lead acid batteries, projectiles for firearms and glass. So these are the uses. Talking about lead acetate, common name is sugar of lead or salt of Saturn. Features are white acicular crystals. So white acicular crystals, and the common name is sugar of lead and salt of Saturn. What about lead carbonate? White lead, that is safida. White powder it is. Lead nitrate, we have crystalline powder. Lead sulfate, we have white powder. Lead chromate, we have chrome yellow color and bright yellow powder. Lead chlorate, white needle shaped crystals. Then iodide, bright yellow powder. Lead sulfide, cubic crystals. Lead monoxide, brick red scaly mass. Lead tetroxide, scarlet crystalline powders. And lead tetraethyl, we have heavy oily volatile liquid. So I just read for the sake of revision, but remember, you don't need to memorize this much. Just remember the examples. What are the toxic compounds? Lead acetate, lead carbonate, lead nitrate, lead sulfate. Fine. So this is lead acetate. This is lead carbonate, and we have lead chromate, which is yellow in color. Now, what is the mechanism of action of lead poisoning? Combines with sulfahydryl enzymes and inhibit the cell metabolism. It also inhibits following enzymes required for heme synthesis and causes anemia. So amino levulinic acid dehydratase, then your amino levulinic acid synthetase, coporphyrinogen oxidase and ferrochelatase. So these are the four enzymes which are blocked by your lead. What are those? Amino levulinic acid dehydratase, amino levulinic acid synthetase, coproporphyrinogen oxidase and ferrochelatase. So it causes hemolysis. It combines with sulfahydryl enzymes, okay, and it stops the cell metabolism. Now what about your absorption, metabolism and excretion? So it is absorbed from all routes like skin, GIT, mucosa, inhalation, all routes. So after absorption, it is stored in bones as phosphate and carbonate. So after absorption, what it is going to do? It is going to be stored in your bones, in which forms? Phosphate and carbonate forms. It is also deposited in liver and kidneys, but most common connective tissue is bone. Lead is a cumulative poison and its rate of excretion is less than absorption. So it is excreted in urine and bile. What are the fatal doses? Lead acetate 20 grams is enough. Lead carbonate 40 grams. Lead tetraethyl 100 mg per kg. And fatal period is 2 to 3 days. Now what are the clinical features? Acute poisoning. Acute poisoning has got, see, lead has got acute poisoning, chronic poisoning. In acute poisoning, it is going to have metallic test. So there are pictures of lead sulfide and your lead tetroxide. Lead tetroxide is orange in color. Yeah. So this is your the heme mechanism, how exactly hemoglobin is synthesized in body. And later I'll tell you how the lead is going to act on it. So to form heme in our body, that is for the formation of hemoglobin, we require heme, right? And this is the process of formation of heme. Succinyl CoA combines with glycine to form delta amino levulinate. Now this delta amino levulinate is formed due to the presence of enzyme amino levulinate synthase. But we all know, we read earlier that these first two enzymes are going to be inhibited by lead. So obviously rest of the process is not going to take place. 4 enzymes, and now these 4 enzymes are involved in heme synthesis. So imagine if all the 4 enzymes would be inhibited by the lead, how heme is going to form? Obviously there would be depletion in the formation of heme. So that is the only thing which they told here, कि 4 enzymes are going to be inhibited. Now we were talking about clinical features of acute poisoning. So in acute poisoning, it is going to have metallic test, vomiting, colic, abdominal pain, constipation, ataxia, apathy, headache, insomnia, paresthesia, lethargy, drowsiness, acute lead encephalopathy, convulsions and coma. Now what about chronic poisoning? See, remember, whenever you are going to write lead poisoning answer in your answer sheet, you should make a table for acute poisoning and chronic poisoning. Even if it is not asked, you should make a table and you should elaborate the features of acute poisoning as well as your chronic poisoning. It also helps to elongate the answer, and number 2, it helps the examiner to give I mean, it helps in scoring more marks. I hope you people understood. So I just want you people either at least mention the names of acute lead poisoning and chronic lead poisoning, because what happens, in question they mention, write a note on chronic lead poisoning, and we tend to forget about the acute poisoning. But if you'll write the acute poisoning also, it will be more beneficial for you also and the examiner also. You'll get more marks. What about chronic poisoning? In chronic poisoning, remember plumbism, satanism at the start of the lecture only. We all know chronic poisoning, lead poisoning is also called as plumbism and satanism. Myalgia, paresthesia, fatigue, irritability, abdominal discomfort or pain, arthralgia, that is pain in joints, tremors, headache, anorexia, vomiting, weight loss, and facial pallor. Now, why facial pallor? Especially around the mouth, that is circumoral pallor. It is considered as consistent sign of chronic lead poisoning. It is due to the vasospasm in addition to anemia. So whenever there is vasospasm, then there is going to be facial pallor in your lead poisoning case. Fine. Now what about your so they have elaborated clinical features here. Number 1, anemia. Anemia is due to the impairment in the heme synthesis. Obviously, if heme is not going to get synthesized, then your hemoglobin would not form. If hemoglobin is not there, then decrease in concentration would be there. Then we all know what is decrease in concentration of hemoglobin called as anemia. So anemia is due to the impairment in heme synthesis and is hypochromic and microcytic type of anemia. There is reduced RBC lifespan. What about blood? There are immature red cells in circulation, such as reticulocytes and basophilic stippled cells. We all know about basophilia, punctate basophilia. Fine. Basophilic stippling or punctate basophilia means presence of many dark colored pinhead sized spots in the cytoplasm of red blood cells. The spots are aggregation of ribonucleic acid due to inhibition of the enzyme pyrimidine 5 nucleotidase that normally eliminates degraded RNA. So in short, remember, why punctate basophilia is formed? Due to the inhibition of which enzyme? Even your pyrimidine 5 nucleotidase. And this pyrimidine 5 nucleotidase is responsible for the elimination of degraded RNA in RBCs normally. So what happens in lead poisoning? This pyrimidine 5 nucleotidase is going to get eliminated. That is why there would be accumulation of the RNA, and that accumulation is called as your punctate basophilia. I hope you people understood. Then we also learned about Burtonian line. Bluish line is present on the gums. The line formation is due to lead sulfide. Lead sulfide is formed due to action of hydrogen sulfide and liberated from the decomposed food in the mouth with lead. What about colic and constipation? Dry bellyache. Remember the word dry bellyache is MCQ. Colic affects the intestine, ureter and uterus. The attack of colic lasts for a few minutes and is in form of severe intermittent cramps. During colic, the abdominal wall is rigid and contracted. Constipation is associated with the colic. Lead palsy, we also observe lead palsy. It is a late phenomenon. The extensor muscles are paralyzed because causing wrist drop or foot drop. Wrist drop and foot drop very, very common in lead poisoning. It is the motor type of paralysis. The motor paralysis is due to the interference with the phosphocreatine metabolism and your peripheral neuropathy. What about lead encephalopathy? It is more common in children and presents with sudden onset of vomiting, irritability, headache, ataxia, vertigo, convulsions and coma. Then we also get hypertension, arteriosclerotic nephritis, amenorrhea, sterility and abortion. Then talking about management, chelation is there. The use of calcium chelate of disodium. We learnt about it. That was calcium disodium acetate, if you remember. So the use of calcium chelate of disodium EDTA act as an ion exchanger in which the Ca+2 is exchanged for heavy metal ion and a soluble and stable chelate of lead is formed. So this lead chelate is excreted by kidneys as a ring complex. This is the management. Then you can also give diazepam for convulsions, thiamine and your calcium gluconate. Now what are the autopsy findings? Pale skin, blue line on gums, emaciation, lead line on x-rays, GIT, we get ulceration, hemorrhage with contracted wall. Then we get renal tubular degeneration, bone marrow hyperplasia. Why hyperplasia? Because the body fights against the decreased synthesis of heme. No, so in order to increase the synthesis, it is going to generate more and more cells in bone marrow. So that leads to your bone marrow hyperplasia. Segmental demyelination of peripheral nerves, paralyzed muscles are flaccid and show fatty infiltration, elevated delta aminolevulinic levels in post-mortem blood. Obviously, we all know why. So these are the autopsy findings in your lead poisoning. Now, what is medical legal importance? Accidental poisoning may occur in children, that is called as pica. Plumbism, industrial hazard, used to procure criminal abortion. Then cattle poison, lead bullet, missile embedded in person in firearm injury may cause chronic poisoning, that is plumbism. However, reported cases are very few because generally in examination we remove the bullet, lead bullet, while examining the patient or while treating the patient. And suicide or homicide is very rare with lead. So these were the features, types, autopsy findings, features of your acute and chronic poisoning, and some of the general features, manifestations, pictures of lead chromate, carbonate, see, then your lead acetate, lead tetroxide, and lead sulfide. So I hope you people understood. This is very important question. Now we are moving towards the next question. What are the poisons? Classify them. Venomous and non-venomous snake. Differentiate. Cobra bite treatment. Manage a case of poisonous snake bite. Steps for identification of poisonous snake and viperine bite. What are the features? So we all know what poisons are. We already classified it in our previous video. Based upon the action and based upon the medical legal importance, and based upon the action we are going to have SINCAP, corrosives, irritants, neurotoxic, then your cardiac poisons, asphyxiants, and your miscellaneous poisons. Then what about those 9 groups which we studied in medical legal importance, medical legal classification? The poisons which are suicidal, homicidal, accidental, then arbofacients, stupefying agents. So entirely that classification you have to write firstly. Then now we'll be differentiating poisonous snakes and non-poisonous snakes. Number 1 trait. What are the head scales? In head scales we'll be writing, we'll learn about poisonous snakes. Head scales, small vipers, large, and these may be small in vipers, these may be large, and if there is an opening or pit between the eye and nostril, that is pit viper. Third labial touches the eye and nasal shields in cobra and coral snake, and no pit and third labial does not touch the nose and the eye and the central row of scales on back enlarged. Under surface of the mouth has only 4 infralabials, the fourth being the largest, that is crates. Simply just write about head scales. You are going to, in one line you can write this. Small head scales are observed in vipers, large head scales are observed in pit vipers, and third labial is observed in cobras, and no pit and third labial is observed in crates. So in simple one line you can describe the head scales. What about non-poisonous? Large with exceptions is mentioned under the poisonous snakes. So large head scales are there in non-poisonous. Now what are the belly scales? Large and over entire breadth. Entire breadth you are going to find out the belly scales in poisonous. But in non-poisonous, small like those on the back or moderately large but do not cover the entire breadth. Remember, this is differentiating point. Entire breadth, no entire breadth. Fangs. Fangs are hollow like hypodermic needles, and these are short and solid in your non-poisonous. Teeth, 2 long flanks are there, and several, this is very important, 2 long teeth are there in your poisonous snakes, but short several teeth are there in your non-poisonous snakes. Tail is compressed in poisonous and it is not compressed in non-poisonous. Habits are usually nocturnal, and these are not so in non-poisonous snakes. So these were the differentiating points regarding your poisonous and non-poisonous snakes. Now we are going to read about the treatment. Polyvalent anti-snake venom, we learnt about it. It is given in India. Okay. It is prepared by hyperimmunizing horses against the venom of the 4 common poisonous snakes. So you are going to inject the horse with venom of these 4 snakes. What are those snakes? Cobra, common crate, Russell's viper, and saw-scaled viper. So plasma is obtained from the hyperimmunized horses and it is concentrated and purified. So you are going to take out the plasma from the horses. The serum is lyophilized by drying it from the frozen state under high vacuum. It is prepared in the Haffkine Institute, Mumbai, King Institute, Chennai, Serum Institute, Pune, and at Kasoli in India. And it is available in the form of lyophilized powder in an ampule. So, it is available, which retains potency for about 5 years. It is useful when given within 4 hours of bite. It is of less value if delayed for 8 hours and is of doubtful value after 24 hours. Each vial of PAV will neutralize about 6 to 8 mg of venom. Its half-life is about 90 hours. Test dose of PAV should not be administered as it is a poor predictor of early anaphylactic reactions and may pre-sensitize the patient to PAV. So what they are saying that instead of test dose, you should give proper dose of this PAV because it may hypersensitize the patient. If the swelling involves at least half of the bitten limb within a few hours of bite in the absence, so you have to if the swelling involves at least half of the beaten limb within a few hours of bite in the absence of a tourniquet, or if the swelling rapidly continues, or if the swelling has crossed a joint within first 1 or 2 hours, it indicates envenomation. That is, the venom has entered the circulation. Swelling that is several hours old is not good evidence of current envenomation. In case of viper bites, incoagulable blood or evidence of spontaneous bleeding from the gums will indicate envenomation. Now, what is going to be the dose? Minimal symptoms, local swelling but no systemic reactions, you are going to give 5 vials. Moderate, you are going to give 10 vials. And severe, you are going to give 10 to 15 vials. Children require the same dose as in adults. The lyophilized powder is diluted in 500 ml of distilled water or normal saline and infused over a period of 1 hour. In neurotoxic poisoning, a second dose of 10 vials should be given after 1 hour. In the case of hemotoxic patients, the initial dose of antiserum will be neutralizing unbound free-flowing venom. The liver requires 6 hours to restore the clotting factors. As such, patient will not require further PAV for 6 hours after the first dose. So what they are trying to say, you have to, in minimal symptoms you will be giving 5 vials, in moderate you will be giving 10 vials, and in severe you will be giving 10 to 15 vials. Children require same dose as adults and it is diluted in 500 ml of distilled water. So this was all about your treatment. Now more points regarding it. 20 minutes blood clotting test. What is it? Few ml of fresh venomous blood is put in a clean dry tube and left undisturbed for 20 minutes and then gently tilted. If the blood is still liquid, it indicates viper bite. This test is repeated every 6 months. This test is repeated every 6 hours for determining repeat dose requirement. Normalization of clotting time is taken as endpoint of therapy. After that, the test is done at 12 hours intervals or at least 48 hours to detect the recovering envenoming. Repeat dosing is required for reoccurrence of systemic signs. You have to perform the 20 minutes blood clotting test and then you'll get to know whether it is viper bite or not. So at the first sign of any of the following, like urticaria, itching, shivering, chills, nausea, vomiting, hypotension, bronchospasm, angioedema, stop PAV infusion. You have to stop the treatment in these cases. Then administer 0.5 mg of 1:1000 adrenaline IM for adults. Okay. Then 0.01 mg per kg for children. Give hydrocortisone and antihistamine to provide longer term protection. If there is no improvement after 10 to 15 minutes, give a second dose. Then once this condition has improved, start anti-serum infusion. If the anti-snake venom is not available, 40 ml of antivenin is given IV and repeated as required. It is effective for cobra, Russell's viper bites. When treating viper bite, a watch should be kept on the prothrombin time. Then what are the signs? There are some of the signs of neuroparalysis. It gives 1.5 mg, then give 1.5 mg neostigmine for adults. And for pediatric doses, 0.04 mg per kg. So in short, no need to write this much answer. In short, in treatment, what you are going to write? Polyvalent anti-snake venom, PAV. Okay, it is given in India. Then it neutralizes 6 to 8 mg of venom. Half-life is about 90 hours and the test dose should not be administered. Then minimal, moderate, severe, we learnt about it, and powder should be lyophilized powder should be diluted in 500 ml of distilled water or normal saline. So this was about your snake bite. So these points are quite lengthy, but I'll just read it very superficially. Then fifth point is you can give heparin 1000 to 5000 IU. It may be your IV if there are clotting abnormalities, then you should inject the tetanus antitoxin. Then a broad spectrum antibiotic is also given, and in viper poisons, sedatives may be given to relieve the pain. Okay, remember this point. In case of collapse, general stimulants are of value. Mechanical ventilatory support is necessary in respiratory failure, and in severe poisoning, infusion of normal saline or transfusion of blood or plasma are very useful. In hemodialysis, hemodialysis may be necessary and peritoneal dialysis is better. Then you have to give paracetamol for pain, but aspirin should not be given as it may make the patient bleed. Surgical debridement of the blebs, bloody vesicles and superficial necrosis may be necessary. So these are the points regarding um, treatment of snake bites. What about the viperine bite? Local features are there in viperine bite. So remember, in this point, this is quite lengthy answer. Just you have to differentiate between poisonous snakes and non-poisonous snakes, and that was about the cobra bite treatment, which we read now. Okay, and further we would be dealing how to manage a case of poisonous snake bite. We learnt it above, the 4 steps. You remember the picture to manage the case of poisonous snake bite, and yeah. Now we are going to learn about the viperine bite, or say vibrate bite due to viper snake. I hope you people understood. Just remember the answer superficially. It is very lengthy answer, I know. Listen it carefully and you are going to remember. Just remember the keywords, the buzzwords like heparin, injection, tetanus, broad spectrum antibiotic, then hemodialysis, paracetamol for pain, surgical debridement of the blades. So these words are going to help you in elongating your answer. Coming to vibrate bite, local features: rapid swelling of the bited side, discoloration, blister formation is there, it may extend to entire limb and even spread to the trunk, bleeding from bite site, and there is pain. This is about your vibrate bite. Then what about the systemic features? Generalized bleeding, epistasis, hemoptysis, hematemesis, bleeding gums, hematuria, melena, hemorrhagic areas over skin and mucosa. Then shock and renal failure. So these are going to be your systemic features. Fine. Now, yeah, so this was about your viper bite only. Two things: local features, systemic features. In local features, you're going to have swelling of the site, discoloration, blister formation, bleeding, pain. But in systemically, you're going to have generalized bleeding, that is epistasis, hemoptysis, hematemesis, bleeding gums, and renal failure and shock. So these are the points. What about aluminium phosphide poisoning? What are the clinical features? What is the treatment, PM appearances, and medical legal aspect? Aluminium phosphide is one of the famous homicidal poison, if you remember. So we'll start with aluminium phosphide. Aluminium phosphide is used as a grain preservative. In northern part of India, it is the leading cause for death due to poisoning. So aluminium phosphide is available in grayish green tablets of 3 gram each. Each tablet releases 1 gram of phosphine. The tablets are available in market with various trade names such as Sulfos, Alphos, Sulfaz, etc. Fatal dose 3 grams, which means um, one tablet is enough to die. What is the fatal period? 12 to 36 hours. What is the mechanism of action? Aluminium phosphide liberates phosphine when it comes in contact with air and moisture. It reacts with acidic media, which is HCl of stomach, and release phosphine gas, which is rapidly absorbed from the GIT by simple diffusion. So phosphine is released and it is rapidly absorbed. So phosphine is protoplasmic poison and interferes with the enzymes and protein synthesis. In animal studies, phosphine has been shown to cause non-competitive inhibition of cytochrome oxidase of myocardial mitochondria. So yeah, in animals it is going to cause the hampering of myocardial mitochondria, and in humans it is going to cause a protoplasmic poison. Then clinical features. What are the clinical features of aluminium phosphide? Metallic taste, vomiting, thirst, burning sensation, pain in abdomen, and diarrhea. Remember, so these are the green tablets. Fine. What about your diagnosis? But before that, persistent hypotension with shock, dyspnea, cough, tachycardia, tachypnea, bleeding diastasis, restlessness, altered sensorium, coma, and respiratory distress. What about the diagnosis? Garlicky smell. I'm so sorry. Very important. Now I'll ask you one question. What are the other poisonings in which you're going to find garlic smell, garlic odor? Find out. So in diagnosis, garlic smell is there, altered liver function tests with raised transaminase levels, increased PT and PTT, prothrombin time. Then APG shows metabolic acidosis, ECG shows sinus tachycardia, ST depression in leads 2 and 3. Then silver nitrate test, very important MCQ. The patient is asked to breathe through a piece of filter paper impregnated with 0.1 N of silver nitrate solution for 5 to 10 minutes. So patient is asked to exhale. Okay. If the filter paper becomes black, it suggests the presence of phosphine. If the blackening is imparted because phosphine reduces the silver nitrate to silver. That is nothing but the principle of your silver nitrate test. Remember, this test is done in your aluminium phosphide poisoning. Now, what is the management? You have to secure airway, Then oxygen ventilator assistance, manage shock with intravenous fluid and inotropic support. Then manage the metabolic acidosis with sodium bicarbonate. Magnesium sulfate administration remains controversial. It is said that administration of magnesium sulfate is beneficial for the management of cardiac arrhythmias. Gastric lavage is contraindicated since the administration of water will release phosphine from the available aluminium in the stomach. Very important point. Which of the following poisoning do not suggest gastric lavage? Aluminium phosphide. I think you people got this. Then magnesium sulfate administration, it remains controversial. It is said that the administration is beneficial for the management of cardiac arrhythmias. Then you have to manage the metabolic acidosis with sodium bicarbonate, as sodium bicarbonate is a base, we all know, and we have to manage the shock with IV fluids. And we have to first secure the airway, that is airway oxygen ventilator assistance. What are the autopsy findings? Typical garlic odor, congested organs, bright fluid blood, pleural effusion, pulmonary edema, then toxic myocarditis, bleeding diastasis. Gastric mucosa shows shedding. Shedding is important word. Kidney shows acute tubular necrosis. Liver shows fatty change, congestion, edema, inflammation, infiltrate in portal tracts and centrizonal necrosis. So as we are studying irritants, remember all of the irritants cause inflammation. We all know what inflammation is. So whenever there is example or say question about metallic or non-metallic irritants, very first point you should be writing is regarding the inflammation, that all irritants cause inflammation. So what is the medical legal importance of this aluminium phosphide? Suicidal poisoning is common with this agent, especially in the northern part of India. I'm so sorry, at the start I told you it is common homicidal poison, but it is common suicidal poison, corrected. Rarely, accidental poisoning may occur to workers working in grain elevators, warehouses, and grain frighteners. So, rarely accidental poisoning may occur, but most common suicidal poison is aluminium phosphide. It comes in tablet. One tablet is of 3 gram each, and 3 gram, that is one tablet, is only the fatal dose. You take one tablet and you are good to go for dying. So this was all about the irritants. We learnt about aluminium phosphide, the features, medical legal importance, the very lengthy question of poisonous treatment and management regarding cobra bite and viper bite. Then we also learnt about the lead poisoning, also important question. And what was our first question? We learnt about treatment of snake bite victim and your, yes, lead poisoning, plumbism, short note. So remember, A, B, C, D, E, F, G is the mnemonic. And I hope you people understood the session. I know it is going to be quite lengthy, but revise the session, listen it carefully. If you have read it once, then this lecture is going to help you in revising before the exams. And yes, the next session would be on neurotoxic toxins. And yeah, until then, keep learning, keep growing. Bye.